Today my topic is examination of skin, nails and hair, and our group is Group J, Wajahat, Usama, Hassan, Ihsan and Moses and Asad. So uh, first we need to know the structure of the skin. The skin consists of the two layers, the the epidermis and the dermis, and there is a subcutaneous layer, and then there's a which consists of fat, also known as the adipose tissue. The general structure of skin. The skin is the largest organ of the body. It is the organ which protects the body from the foreign pathogens. It has two layers, as I have said before: dermis, the inner layer, and the epidermis, the outer layer. It means the beneath and the upper layer. Beneath these layers, there is a layer of subcutaneous adipose tissue. The skin is protective and waterproof, and also important role in temperature regulation by sweating. It has a main role in wound repair and also helps in production of vitamin D. The inspection of skin. To inspect the skin, we generally see the pigmentation on the skin. If it's any pallor, any erythema, erythema means the redness of the skin, any cyanosis, the bluing of the skin. We look at the freckles or moles or any birthmarks on the patient's skin. A widespread color change should be noted, such as overall pallor, which is commonly seen in jaundice, erythema which is seen in herpes simplex infection, cyanosis, which is seen in pulmonary embolism. We need to rule out the color change if it is transient or due to any pathology. Can you please?
Assalamu alaikum. My name is Dr. Ihsan and I am a final year student. So today I want to inspect you. So will you allow me to inspect your skin, nail and hairs? So will I touch you?
थोड़ा आगे हो जाओ, थोड़ा उधर हो जाओ.
Assalamu alaikum. I am Dr. Ihsan and I want to inspect you. So would you please tell me your name? Asad. What's your age?
24.
And your occupation?
Student.
Okay. So today I want to inspect your skin, nails, and your hairs. Will you allow me to do so?
Yes.
Okay. So when we inspect the skin, so we have to see like any lesion like macule, papule, and any discoloration. First we have to see the temperature, and in nails we have to see like the colonacia, if the nail is like spoon shape, and is there any splinter or something like this. So we have to see overall, and we will do it step by step, and Dr. Wajahat will tell us.
Next is the palpation of skin. We use the back of our hands to sense the temperature. The skin should be warm and the temperature should be equal bilaterally.
Yeah. So will you give me your hands? So in this patient, the temperature is same bilaterally, and the skin color is also normal.
The warmth of the skin tells us the normal circulatory status. Next, we check the moisture diaphoresis, which is sweating. We palpate to see the texture of the skin, to check the smoothness and edema.
Yeah. Can you give me your hands?
Yes.
So I check the hands for the moisture. So the in both hands the moisture is normal, and the smoothness, and there is no features of edema.
We palpate to see the vascularity is normal, because if it's the bruising, it means that there is the underlying pathology. We palpate the lesions if present and check their color texture.
Yeah, so Dr. Wajahat, I check the vascularity, and the temperature is normal, and there is no sign of bruising, so it's normal.
This is how we palpate for edema. The grade 1 is 0.2 to 2 millimeter indentation. It means that if we press the skin and it rebounds back, it's a grade 1. If it's 3 to 4 millimeter, it ducks deep. And the rebound is less than 15 seconds. It's grade 2. If it's up to 30 seconds, then it's grade 3. And if it's up to 20 seconds, but the indentation, that Deepening of the skin is 8 millimeter. It's grade 4.
So can I see your hands?
Yes.
So I will check the skin trigger, like to put my finger some pressures on your skin, and then I will see is it rebound and how much time. So this took not that much time, so it's normal.
Then we have the type of skin lesion like pustule, ulcer, vesicle, wheal, papule, macule, cyst, and crust. We'll be discussing them further. The macule, circumscribed flat change in color of skin, less than 1 centimeter in diameter. We have to keep the diameter in mind so that we don't mix the lesions. Where a patch is greater than 1 centimeter in diameter, a papule is a raised lesion which is less than 0.5 centimeter in diameter. And papules may become confluent and form plaque. It means that if papules are there and they are left untreated, they'll form plaque. And after the plaque, we have nodules, which are raised firm lesions. Firm means hard lesions, which are greater than 0.5 centimeter, may have started as papule. As we discussed before, that papule can change into plaque, but before the plaque, it's a stage of nodule. Then wheel. Wheel is firm raised pink red. The lesion wheel is pink red on of the skin. Size and shape varies. Usually itchy, because in all these lesions no itchiness was seen, but in wheel the pickup point is itchiness and last less than 24 hours.
So Dr. Wajahat, as I told you before, I see his skin. It's there is no macules and there is no nodule, so there is no such kind of lesions. It's normal. You can move forward.
Then we have terms that a large papule or nodule, usually greater than 1 centimeter in diameter, pustule and vesicle. Pustule and vesicle are the fluid filled and semi-solid material. When the vesicles are burst, a semi-solid material is ejected from them. Then we have bulla, which is vesicle greater than 0.5 centimeter, a cyst, which is firm, raised, encapsulated lesion filled with fluid. As we know that cyst is the accumulation of a fluid in a localized area, so the skin cyst will also have the fluid. This is a common mnemonic for describing the skin lesion, so that in examination we don't forget to check the lesions properly. In lesions, we need to check the Spell's cap. S is for size, then the pattern, then the elevation of the lesion from the skin, then the color, then the location on the whole skin of the whole body, where is the lesion located, and then the shape, consistency. If you touch the lesion, it is hard, it is soft, it is mobile or not, and then the borders. Border means that the lesion is regular or irregular. Very good, good morning. Then we have the ABCD skin assessment test, which is the rule which is used for suspicious skin lesions. In all the lesions, if this examination in this mnemonic we've seen, and the lesions seem to be suspicious, so we use ABCD rule, which is A for asymmetry, B borders, we check the borders, C again the color, and D diameter. If the size is greater than 6 millimeter, it is suspicious. Elevation and enlargement. ABCD skin assessment. Inspection and palpation of hair. After the skin, we have the hair. So in the inspection of hair, first thing we'll be seeing is color. Due to we'll check the melanin production and texture of the hair. We'll check whether the hair are fine, thick, and any other complaints of the patient. It might be affected due to some hair care products. The texture can be changed due to some hair care products, so you need to know the hair routine of the patient. And distribution of hairs. Distribution means that if there is any patchy baldness or any congenital baldness, you have to rule it out. And we have to check out the hair lesions and any hair folliculitis infections as well. And it should be seen by looking into the scalp by dividing hair into sections.
Yeah, so now I will inspect your hairs to check there is any problem or not. So will you allow me to see? Can you move down? Yeah, so I see this patient. So the hair color is normal, and the texture and the distribution of hair, there is no baldness. So the hair is also normal.
This is how we inspect the dandruff and further lesions of the hairs. We have, because scalp is not visible, so we have to distribute the hair by our hands from right to left. Inspection and palpation of nails, which is very important as it is a sign for many diseases. The start should be from the index finger. You'll be using the index finger as a profile, and the nail base angle, the nail bed angle should be greater than 160 degree, because if it's not greater, like in spooning or clubbing, the angle changes and becomes less than 160 degree. And we check the consistency of the nails. Are the nails normal? Are they broken? Or any lesion or vesicle, like in psoriasis, there are a full complete, I'll be showing that the nails are completely dead and keratinized. We look at the color of the nails because nail are seen to get pale in many diseases like anemia. We check the capillary refill time of the patient.
So now I will see your nails. So so Dr. Wajahat, I see his nails for the any clubbing, and the angle is also normal, and there is no sign of splinter hemorrhages, and so the nail is also normal.
These are common examination, the common diseases which are seen in nails. Bruise lines, this is the proper, you can see the lines form in a symmetric pattern. These bruise lines are usually formed after a trauma, like a patient gets his nails into a door or something. And mesh bands are same, but the pattern is different because trauma does not has a proper pattern. And then linseed nails, in these nails only the half of the nail bed you can see will be affected, and in Terry's nails only the tip of the nails, like this, can be seen. And Kailunaikia, it means that the whole nail bed, the spooning of the nails, and the nail will get up from the nail bed. I'll be showing. And then clubbing, and then psoriasis. These are the bruise lines, the mesh bands, Lindsay nails, the Terry nails, as we discussed, that only the top, the apex of the nail will be affected. And then Kailunaikia, and then clubbing of the nails, and then psoriasis. This is the psoriasis. We will see that the whole rash or the white patchy appearance of the nails. Because sometimes if the psoriasis is not that severe, it will only appear to the extremities and start from the nails. Then we, after the whole examination, we have to collect the subjective data. Because if we don't collect the subjective data of the patient we have collected, we'll miss many points. Ask the patient, is there any history of rashes, any itching, any changes in skin color any time in life, and then changes in skin of hair or nails, changes in color of moles or size, or any itching or irritability to any products or soap, or any product that can cause any reaction to the skin. Thank you. That's all.